This is my audience. Many lives are affected at a young age due to sudden cardiac arrest. News at young kids dying on the basketball court and football fields, or even the wrestling mats, are stories our society can't wrap their arms around. These tragedies can be prevented if an automated external defibrillator is available. Ashley Shepard's survival story exemplifies the advantages of having an automatic external defibrillator available as sporting value. Shepard, a high school sophomore, collapsed in the middle of a basketball practice. A school trainer followed the chain of command by recognizing the situation and called 911. The trainer didn't utilize CPR, but instead reached the AED only 30 feet away. The early actions of the trainer saved Shepard's life, placing her among the 5% of survivors of sudden cardiac arrest victims. Automated external defibrillators save lives. Therefore, AED should be implemented at all sporting and practice facilities in South Dakota. Second, there is a need for policy development to support the placement of AEDs in the state of South Dakota. Third, training should be provided to give CPR and the use of an AED. Nationally, 330,000 individuals are affected by sudden cardiac arrest each year. On average, sudden cardiac arrest accounts for more than 63% of all cardiac-related deaths in the United States each given year. 1. According to the American Heart Association, results of a National Collegiate Athletic Association study that analyzed cause of death for student athletes aged 17 to 23 indicated that 56% of deaths due to medical causes related to the sudden cardiac arrest. According to the American Heart Association, the study also determined that about 1 in 44,000 NCAA athletes die from sudden cardiac arrest annually. Additionally, 75% of deaths that occurred during or shortly after physical exertion were due to sudden cardiac arrest. Evidence also shows that spectators also desire a benefit from the presence of an AED at sporting events. First, AED should be implemented at all sport facilities. Athletic training and competition can increase the risk of sudden cardiac arrest in the young individuals, especially those who underlying heart conditions. The use of an AED caused a drastic reduction in the number of student-athlete deaths resulting from sudden cardiac arrest. Athletes, however, are not the only individuals to benefit from public access defibrillators. Spectators, as opposed to athletes themselves, accounted for an astounding 77%. Sudden cardiac arrest is an electrical failure of the heart's specialized electrical system, and the use of an AED can help joint the heart back into rhythm. AEDs should be implemented at all sports facilities. An AED can significantly increase the chance of survival. Nationally, states have taken mandate AED placement within various types of facilities. 2. According to state laws on cardiac arrest and defibrillators, legislation differs based on the needs and funding options of each individual state. For instance, Georgia requires each public school with an athletic program to have at least one AED on site and easily accessible at all times. The Department of Education appropriates funds to help with purchase of AEDs. According to Medical Update, grants to fund AED programs are available at both the federal and organizational level. In July 2003, President George W. Bush signed federal legislation to provide training and tips for schools on how to raise money to buy AEDs. The automated defibrillator in Adams Memory Act also authorized $25 million for states to increase awareness and establish public access defibrillation programs in schools. Second, AEDs need policy development in South Dakota. According to the National Conference of State Legislation, laws differ from state to state. AEDs need policy development in South Dakota. There are ways for AEDs to be accessible either through grants or state funding. For all facilities should be equipped with at least one AED. South Dakota. However, there is a considerable hesitancy when considering whether to purchase and use an AED. The main deterrent facing the implementation of this life-saving machine is the fear of liability if a mistake is made. This situation has been talked about when Congress passed the Cardiac Arrest Survival Act, or Good Samaritan Statute. South Dakota has passed similar legislation. South Dakota House Bill 1105 states an amendment to earlier House Bill 1245 stated that any person who in good faith obtains, uses, attempts to use, or chooses not to use an AED in providing emergency care or treatment, civil liability for any injury as a result of such emergency care or treatment as a result of an act or failure to act in providing or arranging such medical treatment. According to the website Take Heart South Dakota, training at little or no cost is available through multiple community health awareness programs, and sudden cardiac arrest initiates organizations such as Take Heart South Dakota. Third, AED training should be provided. According to National Conference of State Legislations in South Dakota Bill 1105, people are protected if they are to try to care for someone in good faith. Training is available through public programs and organizations. AED training should be provided. Due to the costly nature of the AEDs and the sparsely populated South Dakota, it is sensible to formulate AED legislation to public gathering areas with higher prevalence of sudden cardiac arrest. In South Dakota, public gathering areas often revolve around athletic events, and coincidentally, they have a high incidence of sudden cardiac arrest. Many states have already taken action to develop legislation stimulating and the expanded placement of automated external defibrillators. It is time for South Dakota to join their efforts to decrease the number of sudden cardiac arrest deaths that occur away from immediate medical assistance. Policies mandating the placement of AEDs in the state athletic complexes will not only save lives, but provide peace of mind. Therefore, South Dakota state legislation should mandate AEDs at all sporting and practice facilities in South Dakota, and training should be provided to give CPR and the use of an AED. Automated external defibrillators save lives. Therefore, AED should be implemented at all sporting and practice facilities in South Dakota. Second, there is a need for policy development to support the placement of AEDs in the state of South Dakota. Third, training should be provided to give CPR and the use of AED.